Now you've got all these doctors and people in residency, they're doing like these skits, and it's a little bit more silly, a little bit more comedic. On the other side, I can see that they're probably trying to do something similar where they're trying to have a, meaningful. What are your thoughts on like the current content that doctors out there?
Just right now, the spectrum has blown up, meaning that before it was maybe doctors in media that would promise miracle cures and miracle potions and snake oil and all this stuff. And that's why I started YouTube, to debunk all of that. So then I started doing that. And then I would react to medical shows and non-medical shows like Survivor or something about medical things that would happen to give commentary on cultural issues. And then it broke out into TickTok short form content, which allowed people to do dances and make skits and do some funny stuff and educate in that way. And it's hard to judge it in general because there's so many different avenues. There's people who are doing it very well and responsibly, and then there's people who are doing it for self-promotion, self-gain, or maybe completely irresponsibly and are not doing their due diligence about what they're promoting.
Just clicks,
or maybe even something negative like sharing disinformation, not even misinformation, where they're actively lying to people about things that are not true about their health.
Right.
So the field has become muddled, and it's difficult to put a single word to describe it these days. I just think you need to approach it with caution, is how I would say.
Yeah, I think it's cool that was there anyone before you that you would put in your category of?
I think we talked about him earlier, Z-Dog.
Yeah, he's been around a
while. He was doing social media. The difference between him and I is he targets more of a medical audience.
Okay.
So people who are in the industry and largely who are burned out from the industry, which is understandable. And I target more of the average person, basically the patient, if you will,
right?
When I make my content. And the goal was really to compete with the Kim Kardashians of the world for clicks and get kids and young folks to watch things about their health that are equally as entertaining as the Kim Kardashians. Right. And so far, with almost 2.5 billion views on YouTube and over 10 million subscribers, I think we've done a pretty good job.
And that's just YouTube. So. I think you have 25 million subscribers across platforms.
Yeah, it's a lot of subs, and it's now grown past just the average person, where now Dr. Fauci comes onto the channel.
Really?
The Surgeon General comes to my apartment and films with me about ongoing COVID issues, vaccination issues. We're getting experts coming on, celebrities coming on. And again, we're doing this at a very competitive level because the algorithms make it very difficult to get your content seen, which is good because it's more democratized. It's not a gatekeeper saying this gets seen, this doesn't get seen. That kind of can get problematic and biased, but this is more the audience chooses, which means that you have to understand psychology, but at the same time be respectful to medicine. Because it's easy for me to take some of the ideas out there that are like, boom, look at this crazy fancy new thing, but it has no real meaning to my patients. So you have to have a very strong moral compass when you do go about trying to get the algorithm to favor your content.
Right.